Joining me now to talk about the big change to mask guidelines is Dr. Lisa Fitzpatrick. She's an infectious diseases physician and a CDC-trained public health expert. And Dr. Lisa, as we call you, I'm so glad you're here. You've been doing quite a bit of work to help educate people in underserved parts of D.C. and really build confidence in the COVID vaccines. We know you participated in a Moderna study at GW. I wonder how you're feeling today after this announcement from the CDC about people who are vaccinated and unmasking.
Well, Leslie, I have mixed emotions. On the one hand, I'm very happy because I know it's stressful to have to wear a mask all the time. It's not fun to have to wear a mask. So to give people some stress relief to take the mask off, I think is a really great thing. But on the other hand, we are now on the honor system. And that means that people who are not vaccinated will have to wear a mask. So I don't have confidence that we will see people who are unvaccinated consistently wearing the mask. Not to mention, it's a bit like a bullseye on your chest, isn't it? So if you have on a mask, are you concerned that people will stigmatize or shame you because you haven't had the vaccination? So I think, this is a bit of a social experiment. So we'll see what happens. But overall, I think it's a good move because as the weather warms up and people are outside, we know that being outside, not only is it good for our mental health, but it is one of the safest places to be during the pandemic because you're less likely to transmit coronavirus if you're outside.
You just mentioned the honor system, and the CDC acknowledges the success of this really does depend on that. But as you mentioned, there are people who may still have questions, who wonder if it really is safe, if they're vaccinated, to be around people who are not vaccinated without a mask. Can you give us a little more understanding of what the science is behind the decision?
Well, the vaccinations are, first of all, they're very safe. But all three vaccinations being administered in the United States have been shown to be very effective. So despite the numbers you're hearing, all vaccinations have been shown to prevent hospitalizations and death. So that's the best news of all. People who've been vaccinated shouldn't worry too much about getting infected with coronavirus because even if they do, they tend to have very mild cases. And so far, we've had nearly 120 million people fully vaccinated against coronavirus, but fewer than 10,000 cases of coronavirus despite vaccination. So those are pretty good odds. But even those who've been vaccinated, it's very rare to see someone have to be hospitalized or to have someone die post-vaccination. So I think this push we're in a race against the clock, Leslie. We really have to get more people vaccinated. It's a very positive sign that we're seeing the rates go down. And if there's any criticism I would have of CDC is that they could have just waited a little bit longer to make sure this curve really is going to flatten. It appears that we're almost there. So I'm hoping for the best.
They're hoping for the best. For people who are still wondering, even with all of this information, what do I do now? You know, my life for more than a year has involved moving around with a mask. And now you're telling me I can take this off. And for some people, that too is jarring. So what do we do with this new information? How do we comport ourselves as we move around?
Yeah, it's such a great question, Leslie. I think everyone has to ease into it at their own pace. Some people will rip it off and be ecstatic and joyful, and others will be a little more cautious and careful. And I think each person has to make that calculation for themselves. But related to my comment about us being on the honor system, I would exercise caution with going into large crowds until we see these rates, the rates of new infections flatten a little bit more. But I want to encourage people to be outside as much as possible. Not only is, nature is medicine. It's good for our mental health. And after all we've endured over the last year, we've seen so much mental health, so many mental health challenges. I want to encourage people to try and congregate with people they know, the friends and family they haven't seen in a long time. So gather in small gatherings at first if you need to, and just ease into it. But as for me, I'm going to take off my mask and I'm going to continue being outside without my mask. So
All right, great advice. And thank you for all you do in the community, Dr. Lisa, to make sure that our family members who are part of the underserved and underseen sometimes parts of our community have access to education and information to empower themselves to survive and, most importantly, to thrive. Dr. Lisa Fitzpatrick, thank you so much for sharing your expertise and your insight.
thank you, Leslie.